And now, Connect with KB.
This is Kristin Beltzer, and I want to welcome you to another episode of Connect with KB. My guest today is working hard to keep Michigan nursing and rehabilitation facilities safe in Michigan. I want to welcome to the podcast my good friend Melissa Samuel, the president and CEO of the Healthcare Association of Michigan. Thanks for joining me, Melissa. It's so great to have you here.
Thank you, Kristin. Glad to be here.
I'm so glad that we have an opportunity to chat a little bit about the work that you're doing and about the Healthcare Association of Michigan. But before we jump into that, I want you to tell me the Melissa Samuel story.
Sure, absolutely. It's funny nowadays to hear this, but it's a fairly short story career-wise. I have not had that many jobs, and that's a good thing for me. That fits my personality. But I was graduated of Michigan State University. I actually did a couple internships when I was at Michigan State. Let me share who I did them with, because
Sure.
I think they're going to ring a bell with you. So one was with State Senator Doug Cruz. Oakland County, remember him?
I sure do.
And then another one was with a company that's now gone, a phone utility, GTE, and the lobbyist was Roy Boudreau. Do you remember Roy?
I do,
Yeah. So that was my senior year of school at Michigan State University. I think I knew early on this was a career track that I wanted to take, and that led me to the internships. And then from there, I've had 3 jobs. I worked for 16 years in the legislature. I worked for my state senator, Senator John Siskey, a short period of time with Representative Chuck Perricone. I think we shared him as a boss.
I think we did too at one point
over
in time.
And then I spent several years with Senator Ken Sikma. And when Senator Sikma was term limited out, I started work with the Healthcare Association of Michigan. I was in the position of their VP of Government Services for 10 years, so I was the internal lobbyist for the association. And then in January of 2018, I took over as the president and CEO of the association.
Well, you also work with one of my favorite people, Becky Beckler of Public Affairs Associates, and they are your multi-client lobbyists. And the two of you have had a great partnership in regards to the healthcare industry and the opportunity to really make a major impact. And I want you to talk a little bit about your organization and kind of the history of the Healthcare Association of Michigan, and really what does it do?
Yeah, absolutely. So it is the professional trade association representing skilled nursing facilities and assisted living settings in the state of Michigan. There's approximately 442 nursing facilities in the state. HCAM has just over about 354 in membership. We started in 1948. If you go back to the history of nursing facilities, long-term care being provided not only in Michigan but across the country, truly started out of people's homes, and then it kind of moved into they were called alms homes at the time, which eventually became kind of the county medical care facilities, and then over time the profession grew in the 1960s. Then with the onset of Medicaid and Medicare, it became an entitlement program, which kind of led to where we are today. So early on there in the late 40s, early 50s, the nursing facilities came together and they formed this organization, healthcare. It was actually called the Michigan Nursing Home Association at that time. And then over the years, that name changed to the Healthcare Association of Michigan. We do have a national association, the American Healthcare Association. So there's essentially an HCAM in every state, sister affiliate we call them, and then our national association. And then at some period early on, the Healthcare Association did hire public affairs associates. I think we were probably one of their first clients going back in their history, and we've had just an amazing relationship over the decades. Becky became our account rep several years ago. It's been decades, I think, for Becky as well. And so my relationship with her in my time in the legislature, of course, we worked together. And then when we got to the association, Becky actually helped me in that transition. So we've been good friends through all of this time. And our work now has never been more important. Truly, probably not a day that goes by that we're not working with Becky and her team at PAA to advance our issues. We're one of the most heavily regulated industries in the country. Probably you'd put us right up there with nuclear power plants and the amount of regulation that we operate under. And then, of course, we're funded by the state and federal government as well.
Well, let's talk a little bit about that, because nursing homes have been hit exceptionally hard and been very vulnerable during the pandemic. How has HCAM been able to work on the state and federal level? And, some of the work that you have obviously had to do with the administration over the last 6 months.
Yeah, this is, there's absolutely no doubt that our profession and the people we care for has been most significantly impacted by this. Again, our residents, their age, their health issues, the congregate living. This virus I've characterized throughout this process has been most unmerciful to our profession and to the residents we care for. So just severely impacted. And then if we go back to the beginning of this and how Michigan was impacted early March, we had our first couple of cases. Within weeks, Southeast Michigan was on fire, and Michigan was being hit very hard and very fast by COVID-19. We now know, as we're 6-7 months into this, that it is community prevalence of the virus that is the number one indicator of it impacting long-term care congregate settings. So in Southeast Michigan, the city of Detroit and the Tri-County area was so severely impacted, it was hitting long-term care settings. The other issue that we've learned since the onset is the phenomenon of the asymptomatic individual who is showing no symptoms or is pre-symptomatic. Obviously, our employee complement, our staff come and go from the buildings every day. And so, again, we were very quickly and very early on, many of our buildings were on fire with COVID. And again, initially, if we go back to the beginning, there was a lack of PPE, personal protective equipment, on a global level, on a national level, on a state level. Our providers were doing everything that they possibly could to source the equipment that we needed to protect staff and residents. But there certainly was a period of time where that was a challenge for us. And then again, we didn't have testing, was not available early on. And you kind of put all of this together and you can see the impact that it had on the number of cases. And unfortunately, obviously we've had deaths in the long-term care settings of not only residents and staff, and we mourn for that. I mean, I had conversations early on in this with our providers. Many of our providers, they've given their life to this. They're second-generational operators. Michigan is blessed with many operators that are second-generational. They're based here in Michigan, and they were devastated, just absolutely devastated to see the buildings that they had, everything that they put together and built around this, and it was crumbling before their eyes. So it was a challenge early on, and we were calling out to everybody, to the administration, to the legislature, and as they were working through all of this on the state and federal level, what are the protocols we should be operating under? Where is the PPE that we need? How can we get testing in place? That was a struggle for a period of time for us. As all of this has evolved, I think we find ourselves now in a much better place. All of those things have stabilized for us. PPE has stabilized. We now have a very, very strong testing protocol in place in the state of Michigan that's been put in place by the administration, by the Department of Health and Human Services. They're funding that testing for us. All of that is critical, very critical for us to make sure that we're doing everything we can, protecting them equipment-wise, protecting them with the protocols that we need for infection control, and then having that testing in place. Testing is probably the most critical thing, protocol that we can have in place. It is our path forward. It allows us to identify almost immediately, within 24 to 48 hours, who has the virus, either staff or residents. And then we take all of the steps necessary to make sure that they're quarantined, they're isolated, and that we're doing the steps and protocols to keep them protected and not spreading the virus.
Well, and not only the protocols, and I suspect that you really have laid the groundwork now going forward, as you just said, in regards to those protocols, but I suspect it was even having to manage the family dynamics too, and how painful that was for your people to have to deal with that as well. So not only do you have this crisis in terms of the protocols and the PPE and all the things that you need in terms of dealing with the nursing homes on a daily basis, but now you have this other exterior component. Talk a little bit about that.
Yes, very early on in the process, the Governor Whitmer, put in place very restrictive visitation protocols, and I think that was absolutely necessary. I mean, the first thing that we had to do, again, particularly when Michigan was still being so severely impacted by the virus and the spread of the virus, was to limit the visitation in the building, and it was very restrictive. Family could not come in. It was essential medical personnel that was allowed, and then staff that had to come and go every day. So over the last 6 months, this has been in place, and so family members have not been able to physically come in and see their family, and under extreme circumstances, end of life essentially is when a family member could come in. So I think throughout the period of time, there really becomes a tipping point of doing the right thing as far as preventing the spread of the virus, but when the period of time has been so extended and you've had that lack of contact between family and their resident, it becomes very difficult for the resident to understand and to really want to continue to live, particularly when our residents, some who have cognitive impairments, dementia, and then in worst case, Alzheimer's. It becomes very challenging for them to understand why their family can't come in, why do I have to stay in my room, we can't have communal gatherings. All of that was put in place. So I think there is a tipping point when the physical and mental health really starts to be impacted. And I think that we're in that period right now. We were very grateful. I think it's been within the last week, 10 days, that we've had a loosening of the visitation restrictions. We can now have outdoor visitation, and providers are now allowing this. They still have to have all the appropriate measures in place. You have to have PPE for both staff and resident. You have to have areas outside for them to go to, tents, depending on what the weather is, all of that. You have to have staff training. So there are a lot of steps that the facility still has to put in place to make sure that we're not doing anything that would cause the spread of the virus, but now allow that visitation. Within the past week, the federal government, CMS, has come out with even broader visitation protocols. They want to now allow for greater inside of the building visitation. They want to allow for more communal gatherings within the building. Many states, though, had more restrictive policies in place. Where we're at right now is the state is working through our visitation guidance and trying to, I think, coordinate and comport with what the CMS and the federal government wants us to do. And it's the blending of those two to make sure we're aware of where Michigan is as far as the virus, but yet allowing, again, taking maybe that next step to allow more inside the building visitation, particularly now as in the state of Michigan, we move into fall and then winter. Of course, ultimately the outside visitation will end. We're going to have to be doing it inside. But again, always cognizant of where the virus is, where is our community spread, and make sure that we're balancing those two. But again, there's just absolutely no that. I think on the family side, there was a great impact. Families were suffering throughout this without being able to see their loved one. But there was, I think, a tipping point for the resident as well. I'm very, very glad to see that we're now at a point where we are bringing the two together and making sure that we're doing in the slow and proper steps to get us ultimately to where we are, hopefully all connected.
Well, with that being said, where are you then in regards to the state budget and continuing to fight for HCAM and the residents that are out there? And what does it look like with 2021 and this opportunity maybe to have potentially some more money funded?
Mm-hmm. It was, we were glad to see the process, the resolution to the budget and the agreement between the legislature and the governor. Initially we were facing a potential cut and that did not happen. So that was step one for us to make sure that we weren't cut through this. I mean, a cut to us right now would have been devastating throughout the whole pandemic. As providers have dealt with the virus, we've incurred significant costs with everything around wage increases to make sure we're doing everything that we can for our staff, purchasing of the PPE equipment, infection control equipment and protocols. Now everything that we're having to do and purchase for outside visitation, tents, barriers, all of that stuff. There's a cost to all of that. That's beyond where we were pre-COVID with just our normal operations. So we have received financial relief from the federal government. There is a gap that remains for us. And I think, obviously, we know that everybody's been impacted by this. All of our providers in healthcare, hospital systems, and then our brothers and sisters outside of healthcare have been impacted by this. So I don't think there's an expectation that we would be made whole on this, but we are trying to close that gap. I think for us, we know that this is something that's going to be, for healthcare provider, certainly ongoing for us as we continue to try to move forward. So one, we weren't cut. The other issue that we're very grateful for throughout this process, we had been advocating for state COVID relief dollars, and between the legislature, Speaker Lee Chatfield, the majority leader, they were supportive of asking for more funding for us. The administration supported that, and now we received $20 million in the budget for just focused for nursing facilities for COVID relief. So that's huge for us.
Yeah, it sounds like it. And I will tell you, Melissa, you are the right leader at the right time for this organization. And I want to thank you so much for joining me today.
Appreciate that, Kristin. Appreciate the opportunity to share everything with you and with your listeners.
You bet. My guest today, Melissa Samuel, President and CEO of the Healthcare Association of Michigan. I also want to thank my supporting sponsors, Marketing Resource Group, White Law, Dowding Industries, Governmental Consultant Services, AF Group, AT&T, and Loomis Law Firm. You can listen to all of my podcasts at connectwithkb.com. Until we connect again, go live your best life. I'm your host, Kristin Beltzer.